Hi, I'm Celina Valenzuela, and this is patient case for week 4. My patient is a 65-year-old, well-nourished Hispanic female. She came in saying that she wanted a clearance for surgery. She was scheduled to have knee surgery 3 days from now, but the surgeon called and canceled her surgery because she has a rash in her groin. It's all in the folds. She's had it for a month. It hasn't gotten any better. And the surgeon said he did not want to do surgery until the rash was healed. The patient has been coming to this clinic for a few years now, so she's established here, but she's missed her last appointments. The patient says it's because she's had pain in her knee and has had difficulty getting around, so she hasn't been here. The last recorded hemoglobin A1C was 8.1. The patient states that she's had a stressful few months because of this pain, um, and states that it saddens her because she's unable to do what she usually loves to do. She is taking over the counter pain medicine, and she has some prescription pain medication as well, which is Norco. But she said she really would like to have this knee surgery because she doesn't like to have to take medication and would like to get off of it as soon as she is able. She has a past medical history of diabetes. She's retired. She enjoys being active but has not been able to do so. And she says that her knee pain is getting worse. She doesn't have any known drug allergies or food allergies. She's had a few past surgeries, tonsillectomy, elbow surgery are the only two surgeries she's had. Um, she is on medication currently for her diabetes. She takes metformin 500 milligrams BID. She has prescription Norco. She takes a tab every 4 to 5 hours as needed for pain, or she'll take acetaminophen 650 every 4 to 6 hours. She so she tries to use the Tylenol if she can. She doesn't really like having to take narcotics, but she will, especially if it's at night. Or she also occasionally takes ibuprofen 400 milligrams. She's current on all of her vaccinations, and her last flu shot was last year in October, and she is scheduled to get one in the next few weeks for this year. Her social history, she lives with her husband of 30 years, who's also retired. Um, she denies any smoking, tobacco use, or drug use. Very rarely has an occasional glass of wine. She tries to eat healthy because of her diabetes, but she says she finds it a challenge because her husband likes to eat out. The patient says that her mother was diabetic and is living and is now 87 years old. She says her father had diabetes and high blood pressure, but he's now deceased. She has two siblings, one sister who's diabetic and a brother with high blood pressure. Her review of systems, she's not noticed any weight change or weakness, fever, memory loss, or nervousness or anxiety. She does occasionally report some feelings of sadness because she has had to stay home more often. She has a red rash along the folds of her groin and some open sores, itching, dryness, and burning. She denies any excessive sweating or heat or cold intolerance. She said that she denies headaches or dizziness. She's had no visual changes. She does wear glasses. Um, she has regular checkups with the ophthalmologist. She reports no seizures or weakness, paralysis, numbness or tingling, or tremors, or involuntary movements or dizziness. She has no shortness of breath, no wheezing, no chest pain. She reports no leg cramps, no abdominal or flank pain or back pain. She has no pain in her arms or her legs, no swelling in her calves or feet, no color changes in her fingertips or toes. Her feet are warm to touch with equal sensation to feet and toes, no cuts or scrapes on her feet, and she has no muscle pain. The only joint pain she complains of is the right knee joint pain, but no other pain in any other joints. She reports no polyphagia. She does have polydipsia. No changes in skin color, no dysphagia, heartburn, pain, change in bowel habits, constipation, diarrhea, food intolerance. She has no suprapubic pain, no dysuria, urgency, nocturia, hematuria, kidney or flank pain. And she has no history of STIs, vaginal itching, or any unusual odorous discharge. Her objective data are her vital signs are within normal limits today. Her temperature is 98, pulse is 73, her blood pressure is 124/82, and her O2 sat is at 99%. She does report that she has some pain today. Her weight is 178 pounds, puts her at a BMI of 31.5. Her skin, on assessment, her skin appears to be warm and of a normal color. It's smooth and dry, good skin turgor, no suspicious moles. Her nails are without clubbing or cyanosis. She does have some red macerated weepy um, areas and rash in her groin folds, and they're associated with pruritus. There's no periorbital swelling or erythema. Extraocular movements are intact. Conjunctiva is pink and moist. Her sclera is clear, no excessive tearing. Her fundoscopic evaluation shows optic disc with normal retinas. Her throat, her oral mucosa is pink. Her tonsils are grade 2. Her neck is non-tender. Cervical area is non-tender. Her lymph nodes are not palpable. No enlarged thyroid. Midline trachea. She's alert and oriented. Her lungs, her respirations are even and unlabored. There's no use of any accessory muscles, no stridor, grunting, or crackles or wheezes. Her carotid is without bruits. She has regular heart rate without clicks or murmurs. Her extremities are warm without edema, no clubbing or cyanosis. Her abdomen, there's no masses palpated or no pain, and no muscle pain, no other joint stiffness, only pain in her right knee. My differential diagnosis are bacterial or fungal intertrigal. She or contact dermatitis. She does have a red itchy rash. It's occasionally weepy and moist. It occasionally burns. It's located in the groin folds. Her plan. Well, the first line treatment is terbinafine topical, but my preceptor chose to put her on chlorotrimazole and have her apply it 2 times a day to the affected area. He prescribed it for 2 to 4 weeks, but he does want her to return to the office in 3 weeks to evaluate what the rash looks like and to see if any treatment, how the treatment is going. She is to continue to take her prescription medication for her knee pain. She is currently prescribed Norco, 1 every 4 to 5 hours as needed. She says that when she takes it, it is effective. She doesn't really like taking pain medication, so she takes it at night. In the daytime, she uses acetaminophen, 650 milligrams every 4 to 6 hours, or ibuprofen, 400 milligrams. Her patient education, we encouraged her to get enough fluid, encouraged her to Try to eat a healthy diet, not only for weight loss, but also to promote healing of the rash. Use your medication as prescribed. Try to keep the area clean and dry. To avoid any tight underwear, to wear loose, airy underwear when she can or at home. And to avoid any allergens, such as highly scented soaps or softeners or on her clothes. And also hand hygiene. She also was ordered some lab work just to see where her hemoglobin A1C was, because her last reported one was at 8.1, but she's missed a few appointments since then. So just to make sure that to see what her medication needs to be changed to and see what her current hemoglobin A1C is today, or when she returns. So she's to return to the office in 3 weeks or sooner if the symptoms show no improvement or if they start to become worse, because her plan is to eventually be cleared for this knee surgery. All right. Thanks for watching. Bye.